We know that patients should undergo testing before choosing therapy, but what testing should take place following treatment?
That's a really good question, and it's a complex question depending on the type of treatment that the patient is receiving. So broadly speaking, in lung cancer, we've separated the field into two types of treatments. Patients with lung cancers will get molecular testing at the onset, right when they're diagnosed, to look for what's called a driver oncogene. So these are mutations that can be targeted with pill-based treatments. And if patients have these mutations, there's about 10 of these right now and several in development, then the patients can receive a targeted therapy. However, if they don't have these mutations, then the standard of care right now is some kind of chemotherapy with immune therapy. So if you're in the targeted therapy camp, my general practice has been to repeat molecular testing upon progression. The reason is that patients who are receiving targeted therapies typically evolve some kind of resistance to targeted therapy. Broadly speaking, you can categorize these as on-target or off-target resistance, but the major reason for doing repeat molecular testing is to understand the mechanism of resistance and then hopefully develop a new treatment with that knowledge. Now, for the camp that doesn't receive targeted therapies, let's say they receive chemotherapy and immune therapy, there it gets a little bit more nuanced, and there is a role for repeating a biopsy and looking for dynamic changes in the patient's cancer, but it is not routine and should be done with consultation with a thoracic oncologist. And really the idea here is that if patients who are on chemoimmunotherapy progress, any additional molecular testing should really help inform what the next line of treatment will be. And sometimes that can be a clinical trial.